Quantum neurology is a very fascinating form of neurological rehabilitation. This is a system that really does help people with very serious problems. We have a quantum neurology doctor who took a man who had been in a wheelchair for 22 years, and that man is walking now. So he specializes in dealing with people with paralysis. Neurological rehabilitation can be as simple as I have a little bit of numbness in my leg from the time that I fell. After a car accident, after a whiplash, you have neurological damage. Most people think if they're not bleeding or nothing is broken, that they're fine. But they've traumatized their nervous system. And this is a wonderful way to help reestablish neurological connections and recognition in the nervous system. There's all sorts of ways the nervous system can go awry. It's a very delicate system. And it's a very, very simple way to help fix it. In quantum neurology, we don't use drugs, and yet we still get great benefits in conditions like MS and Parkinson's. One of the things that I like about my practice is that I deal a lot with chronic conditions that haven't responded well to other forms of treatment. Being able to access the nervous system through quantum neurology gives me a tool that really helps me get in deeply in very serious chronic conditions. And sometimes the condition is neurological and biochemical. So we can address the biochemical instead of using drugs with specific nutritional supplementation that will help the nervous system and help it heal. For example, with MS or Parkinson's, diseases that recently we're able to treat with drugs, with quantum neurology and the proper nutrition, we can treat them without drugs and get significant improvement. If there's a neurologic component, that means the nervous system is not having proper recognition of the area or the problem, or there's toxicity that is affecting the brain. These things can't be relieved with drugs. These things have to be relieved specifically, each in its own way. If there's toxicity in the brain, we have to clear that out. If there's deficiencies and so the tissue has gotten unhealthy, we need to strengthen that up. And if there are neurological connections that are not being made, we need to reconnect them and make them strong. We know when a patient needs quantum neurology when they have glitches that are neurological that we can see, or if we're trying to test for better function, we can use muscle response testing. Something that we do when we're testing for these things is we test, can you hold a strong muscle, which is what we have you do in kinesiology, and do a function? Because normally you should be able to walk and chew gum, right? You should be able to do more than one thing at a time. But if I ask you to do one thing and you can't hold a strong muscle while you're doing it, we know this is overwhelming the nervous system. So if the nervous system is trying as hard as it can to perform the function you want it to perform, and it can't do that and hold a strong muscle, it's not right. It's something we need to correct. I had a patient who came in to see me because after a surgery 2 years before, she had not been able to move her eyes. So her eyes only looked dead center, which meant she couldn't read. She couldn't, she was a music teacher. She couldn't read music because things would blank out because she couldn't move her eyes. And there was nothing in the surgery that she had that would explain that. So somehow, during the surgery, if it was a procedure or a drug or a position, she had lost neurological connection to the muscles in her eyes. And with the quantum neurology, we were able to find out where the weaknesses were, strengthen them up again, and with the neurology and exercises, she's able to move her eyes around again. We had a quantum neurologist who they found he had an aneurysm in his brain. It wasn't a small aneurysm. It was about this big. I've seen the MRIs on it. They told him that because of the size, if he survived the surgery, he would certainly never practice again. He would be in the hospital for at least a month, and it would probably take him a year to learn to talk and walk and feed himself. And they didn't really know how much they could expect for him to get back of his normal functioning. Well, immediately after surgery, they started working on him with quantum neurology, and he was almost constantly exposed to some of the quantum neurology tools. He was out of the hospital in 11 days. He started a new practice within a month. He was walking, he was talking, everything. And what a difference that is from the prognosis that he had before his surgery. So being able to reestablish connection with the nerves, especially immediately, made such a huge difference. What we first do is we do testing. We test the same things that a neurologist tests, only we do it a little bit differently. We add muscle response testing as well. So in a neurology office, they might say, stick out your tongue, put it back in, shrug your shoulders up, drop them back down, smile, pucker, raise your eyebrows up. These are testing different neurological functions. These are testing some of the cranial nerves. One of the primary tools that we use in quantum neurology is called the GRT light. It's named after the developer of quantum neurology. And what it does is it uses infrared light and LED light at certain frequencies. If you hold a light to the bottom of a water bottle, it'll go everywhere in the water bottle. So when we use this light, it permeates your tissue. Unless things are totally severed, the nerves totally dead, if they're not, we can rehabilitate them. All nerves carry components of motor, which is the ability to move, and sensation, to feel. So if we have any motor or sensory abilities left, that nerve is not dead, and it can still be rehabilitated. So it doesn't matter if your injury was years ago. If it hasn't healed, but there's still motor or sensory there, we can usually get it back. It also helps enhance athletic performance. We have a quantum neurology doctor who has been practicing quantum neurology for, 10 or 15 years. And he had 20 of the people who won medals at the Olympics in Beijing were his patients. He has talked about taking a weightlifter and increasing, and we're talking about world-class athletes who are already very strong and very good, and increasing the ability he had to lift by 120 pounds in one session. This is great improvement. Usually what we find is that every sport has a sweet spot. It has a place where you want the most power to be if you're doing it correctly. If you're playing basketball, maybe that's when you're jumping or when you're shooting. In golf, it's right about when you hit the ball. When you're sprinting, it's right when you take off. There's always a place. And what we find is often people have weakness in that sweet spot. And with quantum neurology, we can reconnect that to your nervous system in a stronger way and give you your full power there in that sweet spot. And it makes a huge difference because in world-class athletes, a fraction of a second can make a difference between winning and losing. And when a weightlifter can suddenly lift 120 pounds more, that puts them in a whole different category. That makes them the winner.